When you get to the emergency department, there's not a doctor at the front usually. There's either a tech or some sort of staff. You sign your name, they ask you what you're here for. I always recommend use these words. I think I'm having a stroke. Because if you leave anything up to chance, you're leaving that person who doesn't have true medical training to interpret it. And if you're not at a stroke center, they're not thinking stroke because they didn't get that training. So if you walk in and say, my arm's numb, they're going to think, oh, it's just arm numbness. They're not thinking stroke. Or if you walk in and think, my vision's a little blurry, not everyone's thinking stroke. So if you walk in and say those words exactly, you should, unless the emergency department is completely full, be brought back and examined very, very quickly. And again, let a medical provider figure that out. So what you should expect when you go to any emergency department, I believe, on the planet, or that at least has some machines in it. Prompt and expedited recognition. We have to get the stroke team to respond, draw all of those labs, which take up 2 bullet points, get a CAT scan of your head, get 2 IVs in, an EKG, connect you to a monitor, get a chest x-ray, make sure you don't eat anything, calculate your NIH stroke scale, and start to dial the neurologist after I get my CT results back. All of that should be done in about 15 to 30 minutes once you come to NorthCrest and say the words, I think I'm having a stroke. Strokes, especially the ischemic and the hemorrhagic kinds, are time sensitive. It means the best treatment we have found through all the decades of medicine can only be given usually within 3 to 4 hours. And 40,000 strokes that kill, unfortunately, an American citizen every year. But know that we do not take it lightly. Strokes are serious and we treat them seriously. CAT scan of the brain, again, if an emergency department has one, you should get one immediately. I like to use this point to say that CAT scans do not show ischemic strokes all the time. CAT scans will only show large ischemic strokes. CAT scans will show hemorrhagic strokes. So blood in the brain, you need to know ASAP, ASAP. If you have too much blood, that's easy for me. I'm not a neurosurgeon. There are no neurosurgeons at NorthCrest. I get you to a neurosurgeon ASAP. Because we have that primary stroke center connection, we have a direct line. It's literally a bat phone that sits in the corner. It's a life flight helicopter. Pick it up. How fast can you get here? They get there. They can fly you to Vanderbilt. You should get a complete physical examination, squeeze their fingers, and can you move your arms and legs? That's the bare minimum. So, people, again, much smarter than I, the American Heart Association and the American Stroke Association said, hey, we need to get this message out. How can we do it fast? Well, let's just use the word fast and help everyone remember the signs and symptoms and figure out what to do next. The F in FAST stands for face. This is what most people can notice, even your 5-year-old. Grandma, your face is droopy, or for some reason you realize you can't lift it or you're not smiling properly. That's your face being asymmetric or not even. The A stands for arm. And even though it's arm, it can be leg, but last doesn't work as well, so we're gonna stick with that. If your arm is weak, you can't lift it, numbness and tingling counts, that's a sign and symptom. Speech is probably the first symptom you recognize in yourself. And the T is time. Time to call 911. Not time to think about it. The thing I hear a lot in the emergency department is, I was giving it some time. That's not what it stands for. Time to call 911. Because the more time you take, the more time you're wasting. So if you come to the NorthCrest Stat Desk and say, I think I'm having a stroke, we'll have a full stroke workup in under an hour. And if we deem that you have a stroke, you will get that clot buster within an hour of arrival. So again, time sensitive. The other thing is we have a direct connection with a comprehensive stroke center. Our comprehensive stroke center that we have affiliation with is Vanderbilt. They have the fancy robots down there. In order to keep the connection going when you come into NorthCrest, if I was working that night, I do the full assessment, get everything ready. We can actually speak directly to a neurologist 24/7, 365, discuss the patient, and actually show you to the neurologist. We don't use anything like spaceship technology, just an iPad with FaceTime, but you will be surprised how well it works. Everyone's used FaceTime now in 2019, just about. Everyone knows what an iPad looks, and they only need to look at you. I'm still right there in the room. It's not a fancy robot rolling in and rolling out. I'm there as a doctor. That's just my consultant.